Let me welcome on board then Abhay Soi from Max Healthcare. Abhay, hi, morning. Your occupancy has gone up to about 81% in this quarter. Was it just because of seasonality, or do you expect it to stay there in the next few quarters as well? And how much will be the impact of, the JP acquisition as well going forward?
The second quarter is a seasonal quarter where you have a lot of seasonal flus and seasonal infections. So typically, the second quarter has the highest occupancy other than the fourth quarter. The strong quarters in terms of occupancy always the second and the fourth quarter, and the weaker quarters are the first and the third quarter. So typically, you should see occupancy kind of come down a little bit in the third quarter. But the way to look at it is year on year. So I think you've seen a marginal improvement in year-on-year occupancy. This is in spite of acquisitions of new hospitals, such as Nagpur, as well as Lucknow. We've also added Dwarka in the previous quarter. Whilst JP has been acquired in October, the last quarter's numbers does not have any consolidation of JP numbers.
Although traditionally occupancy was 75% and you've done so many acquisitions, will the levels remain same?
No, if you look at same time last year, it was 78 or 79%. Same quarter last year, which is the quarter two, which is up to about 80, 81% in this quarter. Like I said, there has been a marginal improvement, but the way you need to look at it is quarter on quarter, not on an annualized basis. Year on year rather than on an annualized basis.
Right. Abhay, the other thing I also wanted to talk about is your margins have declined because of the loss at MSSH, Dwarka and the JP acquisition costs as well. Will this impact margins going forward too, or we can expect improvement from here?
I mean, a transaction-related expense to JP Hospital obviously is not a recurring cost, nor is the upfront operating losses when you launch a new hospital. So Dwarka has been launched already. It obviously had operating losses in the first 3 months, which is reflected, which is about 18 crores. We don't expect recurrence of the same operating losses because, it's a hospital which has already been launched. So you're not going to have this on a recurring basis.
What about guidance for margins? Will they come back to 28%?
So there are two things. Look, we don't give guidance on margins or any forward-looking statements. But having said that, margins is not something that we are preoccupied with. You have to keep in mind that any high-end clinical programs enjoy lesser margins, but higher margin in percentage terms, whilst it's higher margins on value terms. I mean, rather do a 10 lakh rupee surgery with a 20% margin than do a 2 lakh rupee surgery with a 50% margin.
Right. Your average revenue per bed in existing units grew about 6.8%, right, to almost about 80,000. How is it that you see this trending going forward, and what's going to be the pricing impact?
Pricing impact typically is about 2.25% every year on our revenues. That consistently, has been the case for many years now. It's never more than that. It sort of just absorbs your healthcare inflation, which is at about 6% of your indirect costs. Having said that, if you see the number of robotic surgeries gone up by about 40-45%, the insurance patients have gone up by 25%, the international patients have gone up by 20-25%. So all of that leads to real growth. You have to keep in mind that all real innovation which happens, really in the healthcare sector, most of which is imparted through the four walls of a hospital. It's the same hospital which used to do simple surgeries maybe 20 years back does robotics now. The same hospital which for oncology used to do surgeries, does radiation, does chemo, is doing immunotherapy now. For cardiac, people who used to do simple sort of bypasses are doing pacemakers, are doing heart transplants. So all of those sort of innovations over years go through the four walls of a hospital. So you tend to see real growth as well. And that is what contributes to ARPOB. It's not really the pricing increase.
Now, there was a loss of about 18 crore in the Dwarka unit. Do you expect this to come into profit?
So before the end of the year, we should be have breaken even and be in profits.
After a drop in patient footfalls due to ongoing political unrest, international patient revenue has gone up by 9% of the hospital sales in the quarter gone by. Once the situation improves, do you expect this also to stabilize?
18% increase year on year. So, the growth in year by year is more significant than that. And yes, I mean, although there has been a very mild impact of, Bangladesh patients coming down to almost zero, we've been able to sort of make that up and more through our other activities and other initiatives in other markets.
Right. Could you also walk us through, what exactly is your payer mix? How much has it changed?
I mean, the payer mix on a year-on-year basis seems to be, pretty much the same. The international patients, of course, has been growing at 20% CAGR. The insurance patients is growing at a fairly fast-paced this thing. I think oncology, robotics has been growing at 40% per year. Oncology, again, has been the fastest growing clinical mix that we enjoy. So we are seeing higher end, payers as well as higher end procedures, which are being more and more sort of sought after. So you're seeing a move up in the clear payer as well as the clinical mix. And that is really what has contributed to the heightened RPOBs, perhaps much more than the 2% that the price increase allows you every year.
All right, Abhay, appreciate your time. Thank you for joining us.
If you like this video, then like, share and subscribe to ET Now.